What factors help decide on cervical cancer treatment options? When facing a diagnosis of cervical cancer, choosing the right treatment can feel overwhelming. Several important factors help guide this decision, and a team of healthcare professionals carefully considers each one to develop the best plan for the individual patient. The first and most critical factor is the stage of the cancer. If the cancer is early and confined to the cervix, options like surgery or localized radiation might be suitable. But if the cancer has spread to nearby tissues, lymph nodes, or even distant organs, more aggressive treatments such as combined chemotherapy and radiation are often necessary. Staging helps determine how advanced the cancer is and guides the overall approach. Next, the size and location of the tumor play a significant role. Small tumors may be treated with less invasive procedures, which can sometimes preserve fertility. Larger or more invasive tumors often requiring more extensive surgery or radiation therapy. The specific type of cervical cancer also matters. Most cases are squamous cell carcinoma or adenocarcinoma, and these types can respond differently to treatments, influencing the choice of therapy. A patient's overall health and fitness are also key considerations. If someone has other medical conditions or is older, their ability to tolerate certain treatments like surgery or chemotherapy might be limited. This helps doctors tailor treatments to minimize risks and side effects while still aiming for effective cancer control. For women who wish to preserve fertility, options like fertility-sparing surgery, such as a radical trachelectomy, may be considered, especially in early-stage disease. If preserving fertility isn't possible, discussions about reproductive options like egg freezing can be part of the planning process. The risk of cancer recurrence influences treatment choices too. If there's a higher chance the cancer might come back, more aggressive treatments, including additional radiation or chemotherapy after surgery, might be recommended. The presence of cancer in lymph nodes is another important factor. If cancer has spread to pelvic or para-aortic lymph nodes, extended field radiation combined with chemotherapy is often used to target those areas. Patient preferences and quality of life are always considered. Some patients may prioritize preserving fertility or minimizing side effects, while others may focus on the most aggressive approach to eliminate the cancer. Participation in clinical trials can also be an option, offering access to new treatments that are still under investigation, which might be suitable depending on the individual case. The treatment options themselves include surgery, radiation therapy, chemotherapy, or a combination of these. Surgery can range from removing just the tumor to a more extensive hysterectomy, depending on the stage and fertility goals. Radiation therapy uses external beams or internal brachytherapy to target cancer cells directly. Chemotherapy, often combined with radiation in advanced cases, helps improve survival rates. For advanced or metastatic cancer, palliative care focuses on symptom management and maintaining quality of life. All these decisions are made by a multidisciplinary team that includes gynecologic oncologists, radiation oncologists, medical oncologists, radiologists, pathologists, nurses, and supportive care specialists. They work together to develop a personalized treatment plan that balances effectiveness with the patient's individual needs and preferences. Ultimately, deciding on cervical cancer treatment involves evaluating the cancer's stage, size, type, the patient's overall health, fertility desires, and risk factors. It's a careful process aimed at providing the best possible outcome while respecting the patient's quality of life. Always remember to consult with healthcare professionals who can provide guidance tailored specifically to each person's unique situation.